Hi everybody, this is Jen Hollenbeck, physical therapist at Corner PT Studio, and today I'm here with Dr. Bruce Hughes of the Art of Medicine Direct. So, Dr. Hughes, how long have you been practicing?
I got my MD 31 years ago, and I came to Charlotte to do my residency at Caroline's Medical System, and I opened my first practice in '91, which was called University Family Physicians. And after 25 years at University Family Physicians, I decided to leave corporate medicine and set up my own solo practice, and I named it the Art of Medicine Direct.
Very good. And so what was it that prompted you to start your own practice?
I watched medicine change a lot over the years, and it got more and more difficult for me to feel comfortable with the care I was providing. It seemed like we were required to see more patients in less amount of time, that I didn't have the time to really listen and spend with my patients that I wanted to. I found that I was running behind schedule, and that was frustrating for me and my patients. And then came electronic medical records, and we were required to do more documentation, more computer entry, to the point where it was very difficult to really provide the quality of care that I always promised myself I would provide.
Yeah, you and I were talking a little bit beforehand, and we were talking about how with the state of how medicine is, a lot of times doctors are getting anywhere from 5 to maybe 10 minutes max with their patients, and how frustrating that can be. Anything else that you want to talk about with that? I hear
that complaint all the time from family, I hear it from friends, and I even hear it from patients who come to me and say, well, the doctor was in the room for 2 minutes and they walked out, and I had all these questions, I didn't get to answer them. So we have a very different approach. We schedule long appointments. We will schedule up to an hour per patient. We want to hear what the patient's concerns are. We want to hear what they're thinking. And so we actually spend the time to listen, which I firmly believe is the best way to come up with the right diagnosis, to figure things out, and to really meet the patient's needs. So we have a very different method of doing that. And I mean Dr. Carwell and myself. Dr. Carwell's my partner, and we both have always had this practice style, and so we wanted to find a practice where we could continue this style of practice and really provide to our patients what we really want to provide for them.
Yeah, absolutely. The other thing that I've noticed a lot, and I hear a lot within the community, is frustration from patients when they have just a couple of things they want to talk about. You know, they want to be able to talk about, I'm here for a well visit, but there's also something going on, like my back is hurting, or, you know, whatever it might be. And how do you guys approach that here in your practice?
When we first started, that wasn't an issue, but as billing cycles changed, as things, it got to the point where it was hard to handle multiple problems, so the administration end of things would warn people, don't bring up extra problems.
Right.
To us, that is contrary to good medical care, because I want to know what all the patient's concerns are, and if they've been told ahead of time to hold back, I'm afraid I'm going to miss something. So we provide the time to address all the questions that a patient has. Logistically, there may be some time constraints, but we're going to definitely handle your most important concerns, and if we need to come back to something on another date, we can do that. But typically, we have plenty of time to talk about anything a person may be concerning. It's rare that anyone has one time, and we respect the patient's time. You take time off. You take the time to come to see us. You don't want to have to turn around and come back to second problem. You want to handle things while you're there. And I find that it's actually helpful. I find that these problems and concerns are not isolated, and that when you put them in together, you really provide a better level of care altogether.
Yeah. I 100% agree with that. I find that sometimes in physical therapy, people will hold back and they'll say, well, I'm really here for my shoulder, and then they'll start talking about their knee, and we have to treat the whole body, whether it's physical therapy or it's medicine, or we're missing something. Absolutely. So I 100% agree, and I think that's amazing that you guys are providing this standard of care here now. So excellent. I'm jumping ahead, sorry. Can you just elaborate a little bit on, your model is called direct primary care, and I know a question that I had was, what's the difference between that and concierge medicine?
It's a common question we get, and a lot of confusion. The number one thing is direct primary care is typically less expensive. With a concierge practice, you're typically paying the doctor a retainer fee, and then in addition to that, they're going to bill your insurance. So the concierge doctors are also still under somewhat of control of the insurance companies. We don't bill the insurance companies at all, but our membership fees are much lower. So we charge a small membership fee per month, and then if you need to come in for a sick visit, it's $20 scheduling fee for that visit, and that's it. We don't differentiate into type level 1, level 2, level 3, level 5. Every visit is the same, no matter what it is.
What the concern
It's
is.
a $20 scheduling fee and your membership fee. In addition, for your membership fee, you get your annual physical, and the labs that you need for your annual physical are all included.
And that's covered with the fee.
That's completely
Yeah.
included with with your membership.
Yeah, I would say that I was actually really surprised, and I think a lot of people are, as far as your patients, at how reasonable this really is to get the level of care that most of us are looking for anyway. So that's really excellent. So if anyone has any further questions for you, how would you like them to reach out?
The best way to answer all your questions is to go to our website. That's artofmedicinedirect.com, and we have just about everything answered there. From the website, you can email us. You can also give the office a call, and our staff would be happy to talk to you about any questions you may have.
And great. And did you mention about scheduling appointments that they can
Scheduling appointments is very easy because you can do it from our website online. So you can just click schedule appointment, and you can go down the list of available appointments and request an appointment. Then someone will either confirm that appointment for you or call you back if we need to pick a different time, or just call the office, and we're ready to find a time for you to come and see either Dr. Cardwell or myself.
And the staff is amazing here, so just call and have a nice chat with them. So that'll be great to reach out. So Dr. Hughes, I really appreciate your time. It was awesome learning about your practice, and I hope that if anyone has any questions, please reach out to him because they'll be happy to answer. So,
Thank you very much.
thanks a lot.